Guys, good night. Today I'm gonna talk about the Hippocrates home care, the service provider protocol of this company that I made. What I choose was the home care. The home care. What is home care? Home care is a kind of hospital. It's a kind of delivery hospital. The doctor goes to your house and they make all the service in your house, provide you everything you need, and give you like feedback with what's going on with you, and then you're all set, and you he or she, the doctor, whatever, is gonna give you a paper with the feedback to the next doctor who is gonna go to your house. All right. So I made everything. I made this protocol. I made this manual in a program that I have here. It calls Canva, and that's it. So let's go to the next page. All right, the introduction of the manual. So for complete patient satisfaction, the protocol manual takes care of every detail for an impeccable service. So for an impeccable service. So what I mean is this manual is for the employees. It's for the employees of the hospital. So they're gonna read this, and then they're gonna say they're gonna try to do everything the manual says that they have to do, So since 1990, the hospital has performed well in its presence, and for this, following the protocol of care is paramount for the maintenance of high index of quality and well-being of the patient. So that's pretty much what I just said. The protocol is just to maintain the well-being of the patient, and then they make a good job in the patient house. All right, the objective of the protocol, the number one of the manual, is transmit information in an organized, clear, and well-organized manner so that the essential information for the patient care is passed on in its internal transference for the effective continuum of the private assistance. So you gotta the doctor has to be clear with the patient. The patient has to understand everything, because since the doctor is gonna be there just for a while, just for a quick moment, the patient is not gonna be able to make any questions. So the doctor has to be clear with everything he says. Number two, the responsibility. It is incumbent upon the nurse to fill in the document medical record and to pass that information on the transfer. So one more time, after the service, after the attendance of the with the patient, the doctor has to record everything and write down everything in a paper, and what we call a prontuary. And another doctor, the next doctor that is gonna be with the patient, is gonna know what was going on when the first doctor got the patient. Let's go to the number 3. All right, preventive actions for all the patients, provide relevant data for decision making and continuity of care, as well as informing allergies, less medications administered, and procedures performed, use of invasive device, important postoperative care, and any relevant complaints, which suggest more attention to the patient and in order to avoid them. So it's not just write down everything you did with the patient, everything the doctor did with the patient. Is a kind of preventive action. So you gotta write down also everything you cannot do with the patient when you get the patient, when you start taking care of the patient. So like the one of the most important things that they have to write down, the doctor has to write down, because one more time, the patient has to be in a well-being, the patient has to be safety. And if you don't write down what you did with the patient, if you don't write down what the next doctor is supposed to do or isn't supposed to do, it's not gonna happen. It's not gonna be safe for the patient. So that's the number 3. And now we're going to the number 4, hygienic actions. That's one of the most important, and we're gonna start right now. Use properly these disposable materials. Discard them in an appropriate place. Use this disposable. So we're gonna start one by one, all right? So the first one right here, use properly disposable materials. Discard them in an appropriate place. What that means. So if you're gonna use some plastic thing or some metal thing and you're gonna introduce in the patient, you gotta discard this in an appropriate place. You cannot use the trash of the kitchen of the patient. No, you gotta put in your own bag, in your special bag, and then throw it away in a special trash or something. All right. Use disposable latex gloves for the protection of the patient and the provider. So the doctor, they know what to do. They even would do this if they were in a personal hospital, in a physical hospital. But it just to make clear, they have to use the gloves. They have to be hygienic, because the patient has to be well-being again. All right, the number 3 of this one is clean the procedure well. So you have to clean everything. You have to clean. If you're gonna use a massage table, you gotta clean everything with alcohol first, and then cover with plastic. Then the patient will be safety for germs and something else. Wash your hands well before starting the procedure. That's the number 1 of the doctors when they get in a room of a patient. They gotta wash the hands. They gotta wash the hands to be safety, to don't pass germs to the patient, because they're always touching the mouth, they're always touching the eyes, and just to be safe for themselves and for the patient's selves too. All right. And the sources I use it, actually I used to work in a home care in Brazil, one of the most important home cares in Brazil. I used to work there, so I used my service of existing business that I used to do it in Brazil, professional experience one more time in the field, and use of the program Canva again. That's what I used to make the PowerPoint. All right. So I hope you enjoy my video, and I hope it was clear for you guys. So that's it. My name is Leonardo. I'm finishing my job.